Magandang hapon po sa ating lahat, mga Katribu. Welcome to another episode of Kalingang, Katribu. Ang inyong kalusugan ay ang aming pangako po sa inyong lahat nang sa ganon, lalong lalakas po ang inyong immune system panlaban sa karamdaman. Kasama po natin si Dr. Iggy Agbayani. Ang matanong ko nga kayong lahat, how safe are you in a bubble? Yan, Doc Iggy, totoo ba yun? Pag nasa bubble ka, safe ka na?
Ang gandang tanong yan dahil controversial din, ano? Alam mo, hirap na hirap ka sagutin yan ng mga scientists dahil hindi nagkakasundo. Ang sagot dyan hindi talaga. Yan ang sagot dyan.
So, ayan, Doc, stop right there. Huh? So, ang sabi ni Dr. Iggy Agbayani ay, you are not sure. Hindi tayo nakakasiguro kung safe tayo kahit nasa loob po tayo sa isang bubble. Okay. Doc, anong ibig sabihin ng bubble?
Yun po yung mga lugar na ang pinapayagan lang, kayo may vaccine passport. So kung kayo po ay hindi vaccinated, hindi kayo pwede doon sa loob ng, for example, restaurant, o isang building, hotel. So that, and therefore, and they feel syempre kung lahat kayo na-vaccinate, parang you can do more things than usual. Hindi na as restricted. That is their idea of a bubble.
Okay, so, sa tingin ng mga taong na naggumawa ng so-called bubble, sa tingin nila, o sa pag-iisip nila, pag nasa bubble ka, 100% safe ka versus the virus, the coronavirus, the COVID-19.
I think ang claim naman nila is less ang chance mo na mahawaan pag ikaw raw ay nasa loob ng virus. And syempre, kung ikaw rin na-vaccinate, malamang kung magkasakit ka rin, hindi rin grabe raw. There's symptoms ang kanilang claim. So, would you like me to go into the details naman?
Yes. Kasi I'm trying to give it to our mga katribu in baby steps, in small portions, from appetizer to the main course. Ayan mga katribu. Sabi nila, ang bubble ay isang lugar kung saan lahat ng mga tao ay vaccinated. Tama ba? At kung meron po kayong fully vaccinated status, kung lahat kayo ay sama-sama sa isang lugar, sa tingin ng mga taong nag-create ng so-called bubble, safe na safe po kayong lahat o tayong lahat. Sabi naman ng mga eksperto, not so fast. Not 100%. Yan ang aalamin po natin kay Dr. Iggy. Bakit hindi 100% safe sa loob ng isang bubble?
Okay, first, Cory, baka sabihin naman nila na hindi naman expert si Dr. Agbayani, ganyan, orthopedic surgeon, CDC PH lang. Well, itong topic na to kasi hindi lang siya about virus, hindi lang siya about vaccine. It is some even social issues as well. So kailangan ng perspective is someone who reads a lot on the topic. So I can claim that. I really read a lot on the topic kasi syempre, I can see how it affects our country. So let me answer that question nga.
Yes.
Remember po, nung itong vaccine ina-advertise na, ang sabi nila, ayon sa kanilang study, o big study po yun, pero single study per vaccine, nakaka-prevent daw ng severe symptoms. Mm-hmm. And they had some evidence na maari pong hindi kayo mamamatay dahil napoprotect kayo nung vaccine. Pero hindi kasing strong ng evidence ng less po ang symptoms. So that is what they promise. Kasi tandaan nyo, nasa ano tayo yung phase 3 studies natapos na. So nasa phase 4 na tayo. So kailangan meron yung study na yon. However, those are just studies of 20,000 people. Now, it's being used everywhere. May mga ebidensya na nagsasabi na baka hindi totoo yun.
Baka hindi totoo yun.
Promise nila na hindi ka ma-hospital, hindi ka maano dahil less ang symptoms. So one of the evidences na nakita po nila is na nag-wane yung effect ng vaccine. No? And one of the things I read is about in some vaccines, not all, up to 30% of the antibodies per month nawawala.
30% per month?
Yeah, so kung yung antibodies mo, marami ka, 100%, about 2 weeks after your injection. After a month from that, siyempre, 70% na lang. After a month, siyempre, 40% na lang. Ganun, palit na palit. And so much so, when we heard that one of the vaccine companies said kailangan daw natin ng booster. Mga pangatlong dose pa. Kasi nga napansin nila na nakakalusot yung virus. Yung sinasabi nilang breakthrough. Nakakalusot nga breakthrough ang tawag nila. So how can you be sure na yung tao may hawak na vaccine passport? Protected enough? Is not contagious? So yun ang mga issues ngayon kasi hindi na pala siya 100%. What if it comes into your place 10% na lang? Pwede na ba yung 10%? How would you know?
Paano natin malalaman? Unless magbibilang sila, i-backtrack nila kung kailan kayo nagpa-vaccinate.
Correct.
Sino ba ang mag-aaral o titingin sa lahat ng mga vaccine cards ng mga taong pumapasok sa isang lugar? Ay, hindi na pwede kasi 3 months ago nagpa-vaccine ka, mababa ang antibodies mo, hindi ka pwedeng pumasok. Paano ba yan?
Yes, and tandaan nyo, may variety po yan. Hindi po yan parang pare-pareho tayong, lahat ba tayo parang kotse. May mga ibang tao, mas mabilis mawala yung starting point nila, hindi 100%. Yung starting point nga nila, 50%. So paano yun? O may mga ibang tao naman, 100% ang starting point. So maybe even yung timing may not be a good enough criteria. Na pag gawin 6 months, dapat hindi ka na pwede. Yung pala, 3 months pa lang, hindi ka na pwede.
Ganon. So, we're back to square one.
Meron pa dagdag, Cory.
Ano yun?
So, akala ko yun lang ang problema. So lately, CDC, the US CDC, Center for Disease Control, revealed that in one of the cities, towns in the US, may study po sila, I just forgot the place, I think it was in Mississippi. They determined that yung COVID variant, the Delta, was actually detected in a lot of the vaccinated people. Ini-expect kasi nila pag na-vaccinate, dapat hindi magkaroon ng magpa-positive anymore. Of course, kung hindi ka na-vaccinate, unvaccinated, hindi unusual yun dahil unvaccinated ka naman . So when they tested them, nagulat sila na ang daming nagpa-positive. In fact, mataas pa yung level of viral load among the vaccinated. So nag-panic button sila, sabi nila, even if you're vaccinated, you must wear mask. Yun ang kanilang defense mechanism dun sa news na yun. Now, is that a fluke? Sabi nila, no. Actually, may lumabas pang isang study sa Vietnam and now in Israel. So showing nga po, pag Delta variant, mukhang nakakalusot dito sa vaccine na to. It may provide some protection, but still that requires proof kasi protection kasi napatunayan dyan sa original virus. Pero hindi yan napatunayan dito sa Delta variant. So now, the question is, should you have a new vaccine or should just a booster be enough? Kasi tandaan nyo, hindi pareho na ngayon yung virus Hindi naman yung parang dadagdagan kita ng, kumbaga, meron kang tangke, tinatawag natin yung anti-tank. Okay, pwede yan. Ay, dagdagan natin ng bazooka para masira yan. Booster. I-booster natin. Pero same guns. Yung pala, ang kalaban mo, tiger tank na, mahirap na sirain. Kahit na booster ka pa, baka hindi rin tumalab. Because it could be a different virus.
Tama. So, Doc, paano naman sinasabi nilang shedding? Anong ibig sabihin ng shedding?
Okay, medyo controversial yung topic na yan. Ano? Kasi they say, bakit nagkakaroon ng mga vaccinated who are shedding nga and are contagious? No? So they claim it's the vaccine itself. Now, yan hindi pa proven talaga yan na vaccine yung nag-shed. But it could be because nagkakaroon nga sila ng strain na mas malakas and they are shedding. And the reason they are called shedding because of the confidence that the person who does not feel anything. And second, because he is vaccinated. Remember, they have less symptoms. So they do not feel anything. But because they're carrying a new variant, they are now spreading it and thinking that they are not. Kasi they're probably asymptomatic o magkakalagnat lang one day, then wala yan, that siguro hindi COVID yun, and they go out. Not knowing that they could actually be more contagious than they were ever before. So parang that will explain yung shedding.
Tapos bakit sinabi naman nila na yung mga unvaccinated ay mas how do I say this? Ay mas nakakaperwisyo sa mga taong vaccinated. Tama ba yun?
Actually, misnomer yun eh. Because the reason you got vaccinated is so that you get protected.
Right.
So if that were true and I did not get vaccinated, then I am therefore unprotected. Okay. So on that assumption, therefore, I am the one endangered, the one who is not vaccinated. How can someone endanger someone who is already vaccinated? On the assumptions na yun totoo. Eh so far, hindi pa naman nila sinasabi na, ay, hindi ka protected pag vaccinated ka. Ayaw admitin na totoo na rin yun dahil nagkakasakit. I mean, you can just look at our data. Ang dami naman na-admit kahit vaccinated. Ang dami naman nagkakasakit kahit vaccinated. So apparently, it's not so protective. However, may claim nga sila, ay, kung hindi yan na-vaccinate, baka hindi na nga umabot sa ospital yan. Ganon. So parang, do you really know that for sure? Hindi eh. Hindi ka rin sure about that. Kasi that requires another randomized test, RCTs, to prove that.
Kasi makikita mo sa mga posts, di ba, sa mga Viber chat groups, no? At saka kung ano-ano mga ibang chat group dyan na sinasabi nila, Mr. So-and-so, asawa ni let's say, Susan, whatever, Santos, let's say, namatay dahil na-expose sila sa isang taong hindi vaccinated. Kailangan, ang may kasalanan ay ang unvaccinated kasi pinasok niya yung virus sa bahay nila.
Okay. Ang ano kasi diyan, ang taong unvaccinated kung magkasakit may symptoms. Ang taong vaccinated kung magkasakit baka walang symptoms. So hindi naman kasalanan ng unvaccinated na na magkasakit din siya. Even if another vaccinated person pwede naman magkasakit at nakakahawa pa rin. So it does not preclude that na unvaccinated. And remember, unvaccinated does not also mean na walang protection. Remember, our data shows more than 2 million people already had COVID. So what does that mean? They have natural immunity. Now, ulitin ko tested lang yon. Paano pa yung maybe another 5 million people who did not bother to test, got sick, and have immunity?
Okay, Doc, let's not answer the question. I will ask now. Kasi bibitinin natin ang ating mga katribu. Abangan sa aming pagbabalik. Matanong natin si Dr. Iggy. Yung mga unvaccinated pero nagka-COVID, kasing lakas ba ang kanilang proteksyon sa isang taong vaccinated? Sa aming pagbabalik.
It's time for the world to know. Outstanding Filipinos in America. The 11th Outstanding Filipinos in America Awards 2021. A salute to the heroes of coronavirus. Coming back live in person at the Carnegie Hall in New York City, home of the TOFA Awards since 2011.
Magpabakuna kayo.
This public service advisory is brought to you by Daily Tribune and 100.3 RJFM.
Magandang araw mga katribu! Narito na ang mga makakasama nyo tuwing umaga sa programang Gising Na. Roy Pelovelo, Comfy Manalo, Chinky Mangkukang, Vernon Velasco, Kim Sancha at Jerk Balagtas. Abangan ang programang Gising Na mula alas 8 hanggang alas 9 ng umaga sa Facebook page ng Daily Tribune.
Ilabas ng mainit na kape at samahan kami sa inyong pag-almusal, mga katribo.
Sama-sama natin alamin ang mga natatagong istorya sa mga latest na kaganapan sa loob at labas ng bansa.
Simulan ang bawat umaga with good vibes sa mga informative and recreational segments dito sa ating programa.
Maaari niyo rin ibahagi sa amin ang inyong opinion via Daily Tribune Facebook page at Tribune Now sa YouTube.
Makichika na rin sa latest showbiz happenings, mga katribo.
Kaya naman, magkita-kita po tayo mula Lunes hanggang Biyernes, alas 8 hanggang alas 9 ng umaga at magsama-sama po tayo sa
Gising Na!
Magpabakuna kayo.
Welcome back mga katribo. Pinag-uusapan po natin, how safe are you in a bubble? Gaano ka-safe ba talaga tayong lahat sa loob ng isang bubble? Ang tanong natin kay Dr. Iggy Agbayani ng CDC Philippines, Concerned Doctors and Citizens of the Philippines, sino bang mas may superpowers? Yung na-vaccinate o yung nagka-COVID pero hindi na-vaccinate? Doc Iggy.
Yes, alam nyo, naging debate yan. Because, sa US, they were claiming that even if you got sick already, you still need to be vaccinated. Ang dami naglabasan, nag-protest ng mga scientists yan. Sabi nila, have we forgotten our immunology? What happened to our immunology lessons in school? And if you get sick, you don't need vaccination because you create your own immunity. So naglabasan din ngayon yung data. Pinakita na pag nagkasakit ka na pala, matagal bago mag-wane yung antibodies. So it now becomes the gold standard of what is the best kind of yung pagbaba po ng antibodies. No? However, sabi nila, so pag naubos na ba yung antibodies, wala nang panlaban sa virus. They know also, pag natural, you most likely have yung T-cell immunity. Ang ibig sabihin nun, ready ka na. Handang-handa ka na just in case lumabas, mahawa ka in 10 months, na gagawa ka bigla ng antibodies. Now, hindi nila alam yon dito sa mga vaccinated kung mangyayari yon. That is still a question to be answered.
So you're saying natural immunity. Lahat tayo meron yan eh. Kung na-expose tayo sa virus at naka-COVID po tayo, may natural immunity na ang ating katawan. And is that a lifelong immunity, Doc?
Okay, hindi pa proven na lifelong immunity. Because you need a lifelong. Diba?
No, that's true ha. Kasi nagka-chicken pox ako nung bata pa. And then when I was about, siguro mga in my late 30s or early 40s, nagka-chickenpox ako ulit.
In the form of shingles.
Hindi. Chickenpox rin, maliliit din.
Yes.
Pero very mild, Doc. Very mild.
Kasi yung nga po, yung chickenpox is actually the same as shingles. And yung reddish, parang mga pimple na maliliit na mapula. Grabe yun. Ako nagkaroon po ako nun eh. Usually lumalabas yun pag yung immune system nyo goes down.
Oo.
So, it could be true with COVID. It might be quiet for a while and then lalabas din ulit. So when your immune system is fine. But it may not be forever. Parang pag-ibig.
So Doc, to answer the question, no, because you already answered it, I just want it reiterated and reinforced. Yung natural immunity ng isang tao, mas pabor pa ang mga batikan na doktor sa buong mundo na magkaroon isang tao ng natural immunity laban sa COVID-19 kesa na vaccination.
Okay, some people try to put words in your mouth na sinasabi, ibig sabihin, sige, magkasakit ka na lang para magka-natural immunity ka. No, I think baligtad eh. You should just take advantage of the fact na mayroong natural immunity. Therefore, we have saved, I estimate po, there are 5 million Filipinos who already had COVID, at least. So you have saved the government 5 million doses if you just follow the right science. Because most likely, not needing any more vaccines. Or at least they would compare to the vaccine. Kasi po, ang difference niyan, yung vaccine would just specify a certain part of the virus to latch on as its pathogen, so to speak, para yun ang re-recognize niya. At yun ang produce niya. Kaya nga po, napakabilis gumawa ngayon ng vaccine. It just identifies a special locus of the virus. But parang natural, will identify the whole virus. So kung meron mang variant na dumating, marirecognize niya kasi the variant is probably 99% the old virus. So marirecognize. Ang problem nga, kung paano kung yung variant na yon, doon sa pagpinilian ng vaccine, kunyari doon sa spike protein na yon, yun ang pinili ng vaccine, doon nagkaroon ng change doon sa variant, hindi marirecognize ng vaccine na immunity. Kasi yun lang siya specific.
Okay. Kailan kaya magiging perfecto or 100% itong vaccine laban sa COVID-19?
Yan ang tanong. Kasi ganito po. People always say na, look, we have smallpox vaccine, polio vaccine. Great success. Alam niyo ba na for every success, meron siguro another 100 failures? Successful nga sila, pero there were more than 1,000 failed vaccines in the history of vaccination. HIV doesn't have vaccine pa rin. Sino ba ang head ng HIV vaccination? Di ba po si Fauci? So he wasn't able to make a vaccine for HIV. Do we expect him to make it in 1 year for COVID? So I don't think so. So ang point ko rin, hindi po madali gumawa ng vaccine. And this is looking like a very complex virus. Mukha po, I actually think that a booster may not be the solution. Akala nila third dose. Kasi yun nga, a third dose of another weak set of antibodies ang gagawin niya. What you need is to tweak. Kailangan ayusin yung bagong vaccine. Kaya lang, baka hindi na siya booster. It may just be a new vaccine after all.
Tama.
And then, it means hindi third dose ang kailangan mo. It may mean you may need 3 more doses.
Correct.
Kasi baka kulang pala talaga ang 2, kailangan 3. So, alam niyo na kung sinong yayaman pag dumadami ang vaccination.
Ayun.
Pero kasi nga, I think it's really an imperfect vaccine. I've tried to choose among all of the vaccines which is best. Mukha talaga ang hirap mag-choose ng best kasi meron silang peculiarities na it is a little stronger, pero meron siyang mga different kind of side effect. So you have to weigh your choice of vaccines. So for me, kumbaga, is this really the set of vaccines I'd like to choose from? I've been also reading kasi, ma'am, na ang dami pong side effects. And I'll just give you what we call a very conservative number. This is a WHO-assisted report tingin sa VG Access. Hindi po itong buyers. Yung buyers, sa US lang yun.
Yes.
VG Access po worldwide. And it's been going on for about 20 years. So ang numbers po ng COVID adverse events using VG Access is more than 2 million. Okay, 2 million. Konti lang yun, Doc, kasi 6 billion naman ang na-inject. Okay? But there also been 10,000 deaths associated with the vaccine. Okay, Doc, maliit lang yun, 10,000. Kasi 6 billion nga naman daw. Pero ito lang, I would like to say that it's an underestimation. Because reporting a side effect of a vaccine is so difficult. Hindi po madali. Actually, kailangan magpa-assist kayo sa doktor para i-report. Paano kung medyo bias yung doktor? Kasi na-vaccinate na yung doktor eh. Baka hindi kayo i-assist, hindi tuloy ma-report. Ang estimate po nila, it is about, you multiply it by 5 or isa namang group, multiply it by 30. Ganun po karami talaga ang true adverse events ng vaccination. Okay. So it looks like really not a perfect vaccine.
Tama. So, ano bang maipapayo natin sa ating mga katribo? Habang hinihintay natin ang perfection ng vaccine na ito, ano ba yung mga safety tips na para sa vaccinated at ganun din para sa mga unvaccinated? Safety protocols sa COVID-19.
Ano po, baka sabihin naman nila, puro na lang negative. Hindi naman. I actually wish there is a good vaccine and this vaccine may be pwede siyang selective. We can find a group that it will work very well without much side effects. It will benefit that subgroup. Ang gusto ko sana ay mag-benefit yung mga elderly saka yung may mga comorbidities. A vaccine that is safe for them. However, I also understand, mahirap talaga gumawa ng antibodies kung ikaw ay may comorbidities at elderly. So we really have to assist it with other things. Yung nga, yung pag-uusapan natin na how to improve your immune system and also to make available yung early treatment. Yun po naman yung isang topic pa.
Tama. Oo, Doc. So, some tips before we have like 5 minutes to go kasi 30-minute show lang. So, Doc, in 5 minutes, ano kaya ang dapat gawin ng ating mga katribo para lalong lumakas ang kanilang immune system laban sa COVID-19? Vaccinated or unvaccinated?
Yes, for both groups.
Yes.
Number 1, take care of your diseases. Fix them. Fix your diseases. And people don't see, wala naman ako sakit. Ay, pero nga pala may hypertension ako. Ay, nga pala medyo obese ako ng konti lang naman. Or maybe, slightly diabetic lang ako, borderline. Yung mga ganyan, yung mga comments. So, actually, yan nga po yung delikado. Kasi ipupush kayo ng COVID-19 to go beyond that. So, kunyari, kayo po ay mildly diabetic. Pag nagkasakit kayo ng COVID, tataas po ng grabe yung diabetes nyo. Yung hypertension nyo, lalala. Kaya nga po maraming namamatay sa ganyang set of patients kasi they're usually not prepared. So now, I'm not saying gamot ang solution. It is one of your weapons, but the best way is really lifestyle change.
Number 1, lifestyle change, ayusin ang mga health issues.
Correct. Diabetes is all about sugars. Number 1. Number 2, exercise, but it's all about sugars. And we are eating just too much, way too much sugars. Unfortunately, my favorite sugar is a fruit. So, siyempre, kailangan ko rin i-limit dahil nga rin siya, is still a sugar. So, hindi po porket fruit, you go ahead and eat as much as you can. You still have to monitor it, have to limit it.
Oo. Pero hindi naman lahat ng prutas mataas sa glycemic index.
Oh, yes. Yes. So yun lang ako kasi I noticed that every time I speak to a patient who has COVID, tatanungin ko kung anong kinakain, sigurado yan. mangga, orange, grapes, tapos lugaw, tapos may tinapay.
Pansit.
Sabi ko, ni isa doon wala ko nakikitang hindi carbs, lahat yun carbs. Sabi ko.
Walang gulay.
Walang gulay kasi siyempre, di masarap yun. Gusto ko yung matamis, gusto ko yung gano'n. So you have to be careful that unfortunately we have to sacrifice yung ating pleasure to eat sugars.
Tama naman.
So, kung pwede lang, ganito po Di ba, lina-lockdown tayo. Sabi, stop business. Pwede ba stop business na sa sugar? I think that would help more than stopping the restaurants.
Exactly. Pero kung siyempre you have a sweet tooth, di maiiwasan din. Choose a no sugar dessert or with sugar substitute na safe tulad ng stevia or coconut sugar na mababa sa glycemic index.
Yeah, it helps. It helps. Ano lang talaga.
Lifestyle changes, ayusin ang mga health issues. Pangatlo.
Don't smoke. Simple, no-brainer. Stop smoking.
Kung hindi ka naninigarilyo pero yung kasama mo sa bahay.
Second-hand smoke is just as dangerous.
Oh.
Kaya nga may kapitbahay ako nakita ko. Sabi ko, ano yun? Para may uso ka. Kita ko, para mga 70-year-old na lola, tuwing umaga nagsisigarilyo. Sabi ko, nako, delikado si lola pag magka-COVID to.
Tama.
Other issues, you must go out and get sunlight.
Sunlight. Tama. Vitamin D.
Yes, hindi talaga po pwede yung just indoors. It has a benefit that is different from taking vitamin D alone. Sunlight really is the most natural way to get vitamin D, and I think it's more potent. And you know what? Vitamin D has been known to help fight respiratory illnesses way before COVID. May studies and scientific studies. And then if you are diabetic, it helps control your sugar. That's how good vitamin D is. If you're depressed, it helps your depression.
Vitamin D to fight depression, right? And diabetes, lahat letter D yun.
Osteoporosis, because it helps you absorb calcium. So sa akin yan, importante, go out. When I say go out kasi, kasama ko na yung exercise. So people think, kailangan, ano bang gagawin ko lang? Treadmill ba? No. Just walk out. Just do it regularly. That is a major difference.
Tama. Okay. Next, Doc.
Well, next siguro, either find a good doctor that is going to partner with you. Don't find a doctor who is going to say, follow me alone. Don't be a partner with the doctor. Befriend them, so to speak. Pero find someone who really wants to let you research. Kasi po ganito ang reason yan. Hindi po lahat tayo pare-pareho. Sometimes the government wants to do this protocol. It may not fit you. So maganda rin na meron kayong kilalang doktor. At best siguro, read. I know it's not easy to find it. So you might want just your doctor to guide you. Ano po bang magandang source? Well, CDC PH is one source. cdcph.org. You can check that out. We tried our best to provide a unbiased view of the science sa COVID. And makikita niyo mga tips namin doon. Or even when you get sick. No? So yun po, you must link with your doctor. The doctor will also help you find, just in case you need to be hospitalized, they will help you also. So sa akin yung malaking factor. In other countries, they call it primary health care. Pero alam niyo, matagal ko na sinasabi sa ating gobyerno, alam niyo, wag po lockdown. Let's work on the primary health care.
Tama.
Pero wala
For you there, kailangan ng Pilipinas isang national health plan na may primary health care. At turuan natin ang ating mga katribo na pangalagaan ng kanilang kalusugan. From the comfort of your home, take care of yourself beginning today. Kailangan mag-upisa tayo ngayon din.
Correct. And yun nga, just walk out. Sorry, skip the dessert.
Or pwede, ito yung trick ko, kumain kayo ng masustansyang pagkain. The same lunchtime, damihan ng pagkain ng gulay. Kasi kalahati ng pinggan, gulay. Oh, good girl, good boy kayo. Pagkatapos nun, after that, teka muna. Pwede kayong kumain ng konting dessert pero isang kutsara lang. Approve na, Doc?
Ang tawag doon, nangiinis lang.
Hindi. Sa kutsara, okay na yun. Doc, we have to
Yeah, I'll
by
tell you
now.
something. I'm a little, partly I'm a carnivore.
So
I eat vegetables,
Mm-mm.
but I really eat fats kasi I think I've seen the studies that show it works also for your health. As long as you keep your sugars down.
Right.
If you have high sugars, don't eat fat. Mali po yun.
Correct. So Doc, contact numbers para sa inyo at sa CDC Philippines.
Yeah, cdcph.org ang aming website. There are some numbers there and people there you can call and some sites you can visit. Yes, you can text me kasi talaga namang kulang na kami mga doktor. And I'm pitching in to treat COVID cases, no? 0917-531-8648. And then banggitin niyo Cory Quirino. Pag walang Cory Quirino, hindi ko tatanggapin.
Yan ang password.
Password. Hindi ko kayo kilala. Hindi niyo alam yung password.
Password Cory Quirino.
0917-531-8648. Just text me first.
Thank you. Password. Masyado mahaba, Cory Quirino. Ate Cory na lang.
Ate Cory.
Marami pong salamat sa inyo, Dr. Iggy Agbayani ng CDC Philippines. Let's get healthy, mga katribo, laban sa COVID-19. Mag-aral po tayo, suriin natin ang mga scientific studies. Follow the science. At take care. Be prayerful. Take the sunlight. Huwag kalimutan ng vitamin D. At huwag kalimutan, ngumiti naman. Because syempre, a happy heart means a happy immune system pa rin. Mga katribo, until next week, ito po si Cory Quirino.
Thank you.